Hi guys, welcome to my surgical diary. It's been a while since we've been here for a surgical blog, but I hope that you will find this informative. I had my 38th birthday on October 13th, 2025, and in celebration of creeping closer to 40, I am flying to Istanbul in Turkey to have 6 surgical procedures at once. So I asked people online to guess what these 6 surgical procedures are. Everybody instantly said boob job, nose job, brow lift, forehead reduction, liposuction, all of these things that they could think of, but it is nothing that will change my physical appearance, apart from a small tweak. Actually, what I am having is a labiaplasty, vaginoplasty, stress incontinence. I'm also having several moles removed. I'm having 4 wisdom teeth removed and Invisalign teeth straightening fitted. So these 6 procedures will all take place whilst I am spending 8 days in Istanbul in Turkey. I will be documenting the entire process from start to finish with lots of detail on my blog tracykiss.com. Obviously, I will also have my video diary here. And hopefully, in sharing my thoughts and feelings, my reasons for wanting these surgeries, I can shed some light in a kind of arena where women's intimate health is often very much overlooked, embarrassed, not spoken about, and filled with shame. So hopefully, answering some of these questions and bringing this discussion to light, we can learn to love our bodies, to feel confident and at ease at any age of life, whether you have had children or not. So my 2 children are now 13 and 18 years old. It's been a long time since I gave birth last, 13 years ago. I had my children at the ages of 19 and 25, as my daughter was born a week before my 20th birthday as a wonderful surprise. So I gave birth naturally twice. I had no complications during the birth process. I did not damage myself at all. There was no tearing, there were no stitches, forceps were not used. It was a completely natural and relaxed delivery. My daughter weighed 7 pounds half an ounce and my son 8 pounds 8 ounces. So he's quite a big baby. And I noticed primarily for me after giving birth, that first of all, yes, everything stretches to the size of a baby head, which is 10 centimeters in diameter to give birth, and then it retracts back. So I know a lot of women are very nervous of giving birth vaginally, naturally, because they worry of what it will do to their sex life. So answering some of these questions, I think, is really, really important for kind of breaking that taboo surrounding intimate health and relationships. So after having my 2 children naturally, I was not offered a cesarean. I was told the only reason you have a cesarean is if something has gone wrong and you are saving the baby's life. So I followed the advice of my midwife and I gave birth naturally both times. I remember at the time of giving birth that I was told to wait as the baby's head was crowning, I believe, like ready to pop out. It felt like bone on bone or rocks kind of heated up and pushing together. And I remember just sort of carefully breathing, and then she told me to push and my babies were delivered. So I know that no damage was caused. I had a successful, safe delivery both times. Therefore, there is no kind of repair work needed for my genitalia after giving birth naturally. However, the way that I then go on to understand how my body changed after childbirth is probably a very different way to how women will discuss this. But I guess if we speak about our own experiences, we can share and compare and contrast and hopefully inform and educate others. So looking at my intimate health after having a baby for about a month, it was very similar to having a period. There was loss of blood and sanitary towels, which is very similar to having a labiaplasty surgery. After this healing, there was tenderness, it was slightly uncomfortable, more sensitive for a while, and then it kind of returned to normal. The difference that I felt, as I have strong pelvic floor muscles from fitness, so doing lots of core exercises, certainly when you are upside down in inversions, I find really strengthens my pelvic floor muscles. It's probably different for everybody. I didn't perform specific exercises that the midwife said because at the time I was young and didn't really understand you know, how to do those exercises. It was just a kind of after thing. After you give birth, remember to do your pelvic floor exercises, but you kind of don't know if you're doing it right. I was told at the time it's like going to the toilet, then stopping and holding it, and then continuing to go. That kind of feeling of just almost clenching and preventing. But whether or not I did it right, nobody knows. I certainly didn't sit there on a daily basis counting out pelvic floor reps. I think years later now, there probably is a bit more technology and understanding, probably tutorial videos that show you how to do pelvic floor exercises at home, or equipment that is useful and suitable. But I didn't need that, as I felt that actually after birth, I was fine. And lifting weights, squatting, really does tighten up that area completely. And when I moved into bodybuilding as a professional bodybuilder in 2017, I got my pro card as an athlete. I noticed that basically rebuilt me down there. It just, everything that had been loosened or weakened from pregnancy was then just naturally restored. And in the 18 years since having my first child, dating over the years as a single parent, I was always told that nobody realised I had had children. Even though I said, you know, when you're dating someone, I'm a mother of two, they said you really cannot tell. You never know if people are just being polite to you and giving you a compliment, or if they really mean it. And I think for women, we kind of have this grey area where we don't know what we should be, how it should feel, what it should look like. It's something that we don't really talk about. Certainly when I came to have labiaplasty surgery 8 years ago now, I had very painful genitalia, the external genitalia, which is your labia. So you have the labia majora, which is the soft encasing lips, and the labia minora, which is where the clitoris is also located. My labia minora protruded beyond my labia majora, which meant that it would chafe and rub on clothing. When I would sit down or I would cycle, I would have to kind of side saddle and turn just to elevate my genitals away from that surface. I went to my doctor after doing a charity bike ride in absolute agony. I could not sit down or walk properly for days. And he said, well, you have excess tissue to your labia minora. The only way to fix this is to go and have surgery. So I did have surgery and it fixed the problem. Fast forward 8 years later, and I experienced discomfort once more from my labia minora. So I went to a clinic and spoke to them about what my options were. And it was suggested that I have filler to my labia majora. As you grow older, your tissue is lost in this area, just as in your face. Aging, collagen, elastin, everything is just naturally reduces with hormones and time. And they said to me, if we make your labia majora slightly bigger, the protective outer casing, this will then contain the labia minora once more. With time and age, you've lost tissue. And because of that, they're now protruding again. So I had 4 ml of filler, which kind of pumped up the encasing, like blowing up an inflatable ring, and it was far more comfortable. But my labia minora still are sensitive, beyond what they used to be after having had my labiaplasty surgery 8 years ago, and as such I'm going for a revision surgery. So as a biohacker, I have lots of treatments and procedures which help my body to regrow, to stimulate cellular regeneration, and I believe that this may have also caused my labia minora to regrow. This, in terms of medicine, to put it into perspective, would be the equivalent of a man having his foreskin removed through circumcision and then 8 years later regrowing a new foreskin. So this isn't something that is supposed to happen. This normally, when you have a part of your body cut off, it doesn't grow back, especially not your genitalia, but mine has, which is possibly a combination of biohacking, as all of my body is regrowing younger and stronger, and that is something that could have regrown, but is certainly not the norm. There is also a difference that happens with age, where inflammation, swelling and stretching of tissue, losing the elasticity, can cause parts of the body to elongate. So as you get older, your nose gets bigger, your ears get bigger, your genitalia can become longer and droopy. This is not drooping. This is very youthful, firm tissue that has just regrown. So medical miracle or biohacking wonder, I'm not sure, but I'm going to therefore return for surgery to have just a bit snipped off, like having the dead ends of your hair trimmed. My labia minora will also be trimmed. So whilst I'm having this external surgery, it's also known as vaginal rejuvenation. You can have external and internal rejuvenation. What that means is restoring your genitalia to a more youthful state and time. So after having had 2 children, I am very happy with the condition of my genitalia, apart from my labia minora just growing again. But actually the sensation that I've noticed has changed. My muscles are very strong. And I think when I spoke to my surgeon, I asked him, what width or depth or sensation or feeling should a vagina be? What is the kind of average? If we look at men's health, men's intimate health, they will say this is the average length and girth, and that's a measurement that you can all compare to. Are you above or below this? This is the national average or the worldwide average. For women, we don't have that. So my surgeon suggested that 2 fingers is the ideal amount that is your kind of happy place for the size of your vagina. And obviously the vaginal canal can be any depth, so some may be longer and some may be shorter, but the width of the vagina should be 2 fingers comfortably. I'm happy with 1 finger also. It's hard to know with the condition of my genitalia after having 2 children how much is due to bodybuilding and muscle strength from the pelvic floor and how much is actual elastic skin that had stretched from childbirth and then returned. For me, the main difference that I've noticed, and the only way I can explain this, I do not wish for this to come across as derogatory or insulting towards anybody at all, but if you were to think of the vagina as a drawstring sports bag, you know, you pull the strings and then it closes at the top and you put your trainers or your water bottle in there for the gym, you can open the top of the sports bag or you can pull it closed and it retracts. I feel like the pulling closed retraction has changed from childbirth to now not retract as much, but the actual canal, the muscles, the internals, I feel are just as strong as ever, just as strong as before children, if not maybe stronger, because I never got into fitness and bodybuilding before having children. So I don't know what I naturally was before giving birth versus what I am now. But from feedback from relationships over 20 years nearly, since having my first child, I've been told that there is no sign that I've had children, which again, I feel could just be compliments as opposed to scientific facts. So going to my surgeon, the only way that I will know if I can have a vaginoplasty, which is the tightening of the vagina, to restore me back to pre-pregnancy condition, effectively to be 21 for the rest of your life. As I'm having external vaginal rejuvenation, internal can work hand in hand with this, and the 2 are often combined. So my surgeon can only tell me in person after a physical examination when I arrive in Turkey if this is a surgical solution. If not, there are other options available to restore and replenish and rejuvenate the vaginal tissue. This can be PRP injections, it can be hyaluronic acid, laser treatments, lots of non-surgical things to plump up and firm that area, increase blood flow, sensation and pleasure. So it will either go the way of having surgery to tighten what I call the drawstring, the entrance, but the passage is okay, or it will be a non-surgical treatment to the area to just kind of boost collagen and elastin. So I will find out what of those methods will be used for a vaginoplasty when I get to Turkey. The next one is stress incontinence. And this is something that affects women at any and every age, whether you've had children or not. It is a natural part of aging, and some women are very young and experience stress incontinence. So it can also be connected to health and lifestyle factors. So my whole life, I've never had a problem with wetting myself, even after giving birth. I have strong pelvic floor muscles, everything was okay. So touch wood, it was not something that I was worried about or concerned with as a result of giving birth and was not there naturally for me. At the age of 38 now, within the past year of my life, I have leaked urine twice, and I find that so concerning because it's not something that I enjoy. The first time I sneezed multiple times in a row with a full bladder. I already needed to go to the toilet. I probably would have gone in 5 or 10 minutes. But as I sneezed, the pressure of sneezing caused me to have a trickle of urine in my underwear, and I was horrified. But I know is a normal thing for women to experience in life. I ran to the toilet, I went to the toilet properly, and then changed my underwear and washed, and just felt really grossed out by it. I recognise in supermarkets and stores and pharmacies there are panty liners, there are sanitary towels, all of these things. For my period I use tampons, as I don't like anything externally outside of the body with moisture. It does not feel comfortable for me. So the thought of ever wearing a panty liner or a sanitary towel or something to catch leaks really is not something I would ever want to do. I'm very often in gym wear. I can jump, I can squat, I can run, I can be on trampolines, I can lift weights. I'm perfectly fine with that. I have great control. But sneezing with a full bladder once leaked urine, and then about 7 months after that, I laughed so hard at a joke and you can't breathe and it feels like someone's punched you in the stomach just because you are just heaving with laughter, that deep ache. I then squirted again and I thought, oh my goodness, this has happened to me twice now within a year. So I want to have something permanently done about this. Now, I also, in the past year, was diagnosed with Ehlers-Danlos syndrome. I'm actually hypermobile Ehlers-Danlos, which means that the ligaments in my body, the joints and the soft tissue are very stretchy, very flexible, very bendy, as are my organs and internals. So as a result of this, people who have EDS, or it's known as HEDS, hypermobile Ehlers-Danlos syndrome, often experience stress incontinence. Stress incontinence is identified as the leakage of urine when a stress is placed on the body. So whether you laugh, you cough, you sneeze, you jump, you run, you do something physical, you cause a leakage of urine to escape. And it's very closely associated because of Ehlers-Danlos syndrome. So to reach the age of 38, I've had 2 squirts of urine, not completely wet myself, but just a little trickle go, oh, what's that? In the past year, from the age of 37 to 38, I knew there was something that needed to be done about this because I do not want it to progress. And I am aware that with time, with age, as the body changes, as muscles become weaker, this could well be the point where I sneeze in public and wet myself walking down the street. And that's not something that I would ever want to happen. I know that it's natural, but I want to live my life, my best life for as long as possible, be proactive with preventing this from happening. So I will be having a sling fitted, it is known as, where 3 incisions are made to put almost a hammock under the urethra where urine is released, where it comes through. You have 2 small incisions around 1 centimetre each on either side of the groin or the top of the thigh, as well as an internal vaginal incision. This allows them to put a strip of gauze almost that goes under the tissue to lift and support it. This stops any kind of stress incontinence from happening. Whilst I'm having my external labia minora, potentially vaginal tightening through vaginoplasty if it's necessary for me, I will also have the internal stress incontinence sling fitted, which is known as TOT medically. So these are all small procedures in themselves. They can be performed in a matter of hours and tied together in a combination, which works really well for those 3 surgeries to take place at once. I'm also having my 4th surgical procedure taking place within this same general anaesthetic when I am asleep, and this is to have several moles removed. Now, I've had moles removed in the past because they were lumpy. I would catch them on jewellery, on nails, they would bleed, they were uncomfortable. They kind of over the years had raised up and just become lumpy brown pieces that I catch. So I have a few moles scattered around that I can kind of pinch and pull, and they're not very desirable. I've caught them so many times. They bleed, they darken for a week or so as they're healing like a scab, and then they return to just being lumpy and brown. As it's considered a surgical procedure to remove a mole, GPs and doctors will not commonly do this unless there is the risk of skin cancer, that something has changed and is causing infection or consistent bleeding. I perhaps catch my moles maybe once every 4 to 6 weeks. It's not an everyday occurrence, and it's certainly not something that I would want to go to the NHS for, to take the funding away from a patient who has skin cancer. I don't believe that any of my moles are cancerous, whilst they are raised, unsightly and inconvenient. So whilst I'm already having surgery, I can have these removed. Should I wish to remove them in England, I would have to book into a clinic or to see a surgeon, and it would be a greater expense. So going to Turkey to have mole removal whilst I'm having another set of surgeries, it's just easy to tag them into the same procedure. You pinch hold of them, run a scalpel level with the skin, and the mole is gone. A plaster goes on it within a few days. It's scabbed, it's healed as if you've cut yourself, and there is a brown dot left from the pigment, but it's no longer a dome or a lump that is protruding from the skin. So it removes the risk of catching or scraping them on clothing and jewellery as if they were still lumpy. So I'm very happy to have those done. Then I move into my second procedure. Now this is not performed whilst I'm asleep under general anaesthetic, although some people sometimes do have this. I am having my 4 wisdom teeth removed at once. This is a form of preventative dentistry for which there are traditional and modern interpretations of this. So the traditional insight of a dentist is to make sure that teeth are preserved for a lifetime, that teeth are not just pulled out willy-nilly, that extractions are the last resort to everything else that you've tried, from filling a tooth, root canals, hygienist appointments and things. They will do everything in their power before ever giving up on a tooth and then removing it. A lot of people go to Turkey for turkey teeth, which is kind of known as having veneers fitted, having fake teeth, very square teeth, very white teeth, that Hollywood smile that's so perfect, kind of makes the rest of you look a bit wonky in comparison, and you think the teeth really stand out and look unusual if overdone. I know in modern day practice now, turkey teeth are not as square or as bright white as they used to be. They look a bit more in keeping with a natural smile. I do have natural teeth myself, these are all my own teeth, but having my wisdom teeth removed is probably not the first thing you would think of going to Turkey for when you think of dentistry. In the UK, as I say, that it's customary that you do not remove teeth. So a few years ago, I had my wisdom teeth scalpeled, where the bottom lower back wisdom teeth, they were pushing on the gums so tight it was agony to eat. They just would not cut through. So my dentist used a scalpel to split the gum open to relieve the pressure and allow the teeth to burst through. It was hideous, but that is all that my wisdom teeth have ever caused me. Just the bottom ones with a lot of pressure whilst they were coming through. Fast forward to this year, at the age of 38, I've had just one filling my whole life, which was heartbreaking because I have such a healthy diet. I don't eat sugary things, I don't drink fizzy drinks, I live vegan, healthy and clean, and my dentist said, don't be disheartened. Make sure you combi brush with an electric toothbrush as well as a soft bristled handheld toothbrush, and I just upped that cleaning in that area, and it was fine. I go for dental checkups every 6 months just to have my teeth looked over to catch if anything is going wrong before it needs a treatment for that reason. In preventative dentistry, going for regular checkups, not just if you have pain or discomfort or something changes, you can spot something before it gets bad enough that it would cause long-term damage. So in one of these checkups, I said to my dentist that I had a funny taste in my mouth. It kind of tasted like I'd accidentally ate a bad peanut or something. Sometimes when I'm eating pistachios, you can have like a moldy one in the bag that kind of wrinkles up and goes a funny colour, but when you kind of pick them up and eat them, you don't notice. and I thought I'd eaten something that had just turned slightly, a piece of fruit that maybe I didn't notice had badly bruised, but I had this funny kind of aftertaste in my mouth for a couple of days. So at my 6-month check at the dentist, I said, where is this coming from? And my dentist informed me that my wisdom teeth needed more attention to be able to be properly cleaned. So my wisdom teeth are actually at kind of 45-degree angles at the back of the mouth. So where you're normally biting, your teeth are on a flat level. The wisdom teeth, however, go on an angle. So to get the toothbrush around there, the toothbrush head is like this. How do you get up there? It's kind of back behind the jaw here. So they're notoriously bad for rotting and plaque and build up and needing to have them removed for that reason. My teeth have not reached a level of decay where they are deemed as necessary for removal. For me, any level is not suitable. I want them all to be clean and healthy and strong. And that's when I discovered preventative dentistry. So against the wishes of traditional dentistry, preventative dentistry says, do we need wisdom teeth? They're not there for chewing. They are the excess teeth that put pressure on the others, pushing them out of alignment. They cause a lot of pain normally when they are cutting through, or out of nowhere can just be very insanely painful without warning at any stage of life. They also are likely to decay and rot and cause bacteria, which then feeds into gum disease, as well as going through to the saliva, down into the stomach and affecting the gut. A lot of knock-on effects, negative symptoms in keeping your wisdom teeth. Now, my wisdom teeth, aside from pushing through the gum initially and needing a scalpel to release them, have not caused me trouble. I had this funny taste for a couple of days. I used a mouthwash, it went away, and now my dental routine is the same. My dentist informed me that I could easily keep my wisdom teeth for the rest of my life without a problem. However, with time, it's expected that they will worsen and decay, as most people's natural teeth do. The choice to have my wisdom teeth removed is something that I have thought long and hard about. When you are younger, your wisdom teeth are not as deep and not as strong. They're not as built into the jawbone. As the older you get, the bone ossifies and gets harder. So the longer you leave your wisdom teeth in, the harder they become to remove. This can cause a lot of damage to the jaw when pulling them out later on in life. So it's a case of kind of weighing up. Do you remove them before they become a problem, when it's cheaper and easier and less painful to pull them out in your 20s or 30s? Or do you wait until your 40s, 50s, 60s, 70s, until you are left in agony after fillings and root canal and gum disease that it's caused and digestive issues, where it can potentially cause a lot of problems to your jaw bones when extracting them at a greater financial cost? I personally feel that preventative dentistry is the right choice for me. It may not be for everyone, and I've never had a wisdom tooth removed. I'm aware that it is uncomfortable. So I booked in for all 4 to be removed on the same day. Maybe this is naive, but I know ultimately when I'm not considering pain or discomfort, making sure that the rest of my teeth are not negatively impacted is my main concern, as well as preventing future suffering for something that will only ever worsen. It can't get better. So the decay of my wisdom teeth over nearly 4 decades is not severe enough to have it removed in the UK, hence why I am going to Turkey to a dentist to have them removed. So whilst people have turkey teeth, I will be having my natural teeth just properly looked after and taken care of. This can involve a hygienist, cleaning the teeth extensively, removing the wisdom teeth, and then checking for any risk of infection whilst I'm there recovering from my intimate surgery. After my wisdom teeth are removed, I'm then having Invisalign fitted. So Invisalign is teeth straightening. Several years ago now, I had adult braces. I had them fitted because I had very wonky teeth that were kind of tilting inwards, overlapping, and I would bite my jaw together in my sleep and chip my teeth because the teeth had moved out of alignment and were kind of rubbing against one another. So they were quite tender. I had my teeth straightened with adult braces, which pulled them back into alignment. That was a square on each of the teeth, wires fitted. Over the space of 4 months, my teeth were then lovely and straight. However, I was not aware that teeth actually shift for the rest of your life, especially right after they've been straightened. When the braces came off, they started to move out of place. So when they started to move out of place, my dentist fitted a fixed wire on the back of my teeth, which is the very front section, kind of here, across. A fixed wire was glued to hold them from moving. On the back of the teeth, top and bottom. And then I also had nighttime retainers. Pop them into the top and bottom of my teeth and it holds them in place overnight to prevent any movement. Naturally, our teeth move our entire life. It's completely normal through speaking, eating, trauma caused to the face if you get hit. It's the teeth being held in the gums. So when I had my fixed braces, the braces were tightened every few weeks to pull them tighter, bring them into alignment. With Invisalign, it's very similar to just having retainers. You have a scan of your teeth in the place that they are currently positioned, and then you decide where you want them to be. So you can plan it all in advance on a computer, see the virtual model of what your smile will be before it is created. And then trays are 3D printed. 1 or 2 weeks, you wear the tray, you pop them in, gradually moves your teeth by a fraction at a time for as many stages as necessary to get you from start to finish. So you go for a checkup every 4 to 6 weeks with your Invisalign plan, and your new trays are just given to you to say, yes, you've completed stage 1, move on to stage 2. A few weeks later, yes, your teeth have moved enough, move to stage 3, and so on and so forth, for as many as it takes for your individual treatment. Now, obviously, having my Invisalign fitted in Turkey, I'm not going to fly back there once a month or once every 6 weeks to go and have a checkup. So I am able to return to England and have the rest of my treatment completed by my dentist in England. So my scans will take place in Istanbul, and my treatment will begin. It will be fitted and checked that everything is in place, and then the maintenance will take place for a few months once I am back home in England. I won't know how long it will take to complete this process until I have my scans and they see just how far my teeth have to move, but for the rest of my life I will wear retainers every day. They will probably go back to the nighttime retainers only, but when I am having Invisalign treatment, I will only take them out to eat and drink. So they are worn for around 22 hours per day. This means, should you go to a wedding, you can pop them out and smile for pictures. They're very discreet. They are clear trays that clip over the teeth, the aligners that pull them into position. If you have a meeting or something, or you're having a photo taken for your passport, you can pop them out, but you want to wear them for 22 hours of the day to maximize the results in the shortest space of time. So to have my Invisalign fitted, after the treatment is complete, I will continue to wear nighttime retainers, perhaps have a wire on the back of my teeth once more to ensure that my teeth stay in place. So wear your retainers, guys. So these are 6 treatments that I am going to Istanbul in Turkey for. They cost £40,000 in the UK, and some of those I can't have in the UK, such as the wisdom teeth extraction. So my diary will include the entire process of all of these, as well as my blog on tracykiss.com. I will show you exactly what's involved. I will be meeting with my surgeon as soon as I land. I will have any pre-surgical checks and consultation take place, and then I will fast in the evening and have my surgery the following morning. This gives me 1 week to recover in Turkey, to be checked over by my surgeon, full medical support from the nurses, and some rest and relaxation before I fly home to my children, to work and my pets, and the chaos of everyday life once more. Surgical aftercare is so important, and I highly recommend that if you are having any surgical procedure, you take 1 to 2 weeks off work and you rest and relax. Hygiene is so important. Stopping smoking, stopping drinking alcohol beforehand, boosting your immune system so you're fit and strong for surgery, and then resting properly. So ahead of my surgery, I have ordered some bits online. So I picked up a multi-pack of these ladies boxer shorts, which are just a bit larger than the usual G-strings that I wear on a daily basis. This means that after my surgery, when I will have a kind of panty line, a sanitary towel there to catch bleeding and swelling, they can stick to this underwear because it has a wider area than, as I say, the G-strings that I always wear. I also picked up some loose-fitting shorts, so just to make sure that there is no chafing or friction and rubbing in that area, just a little bit more looser, baggy, loose bottoms for the first couple of weeks of recovery. And then for my surgery, because I really want to understand how progress can be made, if progress is necessary, if I am suitable for a tightening surgery, I have these dilators to take to my surgeon. He's probably going to think I'm insane, but that's okay. It's good to ask questions. So these are for the purpose of stretching tissue in orifices. I do not need them for stretching. I'm going to use them as a ring sizer to tell you what size the vagina is and measure any progress. I think I am perhaps here, if not here. So we shall see if I am a candidate that is suitable for vaginal tightening surgery. If not, if it is lasering, injections, or hyaluronic acid. I think it's really important that we don't feel embarrassed or ashamed to talk about intimate health. It's something that makes such a difference to our lives, from our relationships, from our self-esteem, and the way that we live and love our bodies as time changes. Age has such an impact on what we are used to, what we know, how we view ourselves. And I think if we have these discussions, we know what is available for us. Whether you wish to make a choice to have a surgical or non-surgical treatment, it's entirely down to you and your quality of life. Personally, for me, if somebody told me I could be 21 for the rest of my life, I would see no downside in pursuing that. And as I am having stress incontinence and a labiaplasty revision at the same time, to have a potential tightening of the drawstring of the vaginal area, not necessarily the canal, I think that would be wonderful. So if it's possible, we shall find out. If it's not, then I'm sure I will find other methods of how to improve sensation and pleasure after having had children. Just as I would imagine if a man was asked if he wanted to add an extra inch in length or a slight more girth, if you were asked about your height as a man, would you like to be over 6 foot? We can give you another few inches. Most people would say yes. It's not a do or die scenario. It doesn't mean that it's the be all and end all of life. There is certainly more to life than your genitals. But if you have the opportunity to select, what would you like to heighten? What would you like to improve? I think it's important that we're aware of this and we have freedom of choice over our own bodies. So I'm very happy with the condition of my genitalia, but if it could be slightly more sensitive, if there could be more pleasure, and if the drawstring could naturally be a bit more closed, I think it would just be the icing on the cake to feel myself that I have not had children. So for me, it is the opening sensation that I would like to address if at all possible. So thank you for joining. Come along with me to Turkey. I am so excited. Just a couple of days until my flight. I will be collected from the airport by the concierge, taken to my surgeon, to the hospital, back to the hotel for my surgery, all of the itinerary taken care of. Food whenever I want it, rest and relaxation, a spot of shopping perhaps, just some time to relax and recuperate after these procedures before I return home to my beautiful family and continue the rest of my recovery, knowing that I am in the best of hands for that 1 week of recovery post-op. So I hope you find this helpful. I welcome you to join me, and I will see you when I touch down in Turkey.